Oh, well, it's actually so amazing to see everyone's names flashing up. I only wish I could see all of your faces, but there's actually, I think, potentially going to be about 70 or 80 people on this call. So you can see us, but we can't see you at the moment. But look, thank you so much for joining us. It's just so wonderful to connect with our community. I think all of you know that at the Hunger Project, we are all about community. And we've actually really missed all of you. I certainly have very much missed everybody and connecting with you. And I think during lockdown, one of the things that it's highlighted is so much the importance of community and reaching out and connecting. So thank you for being here today. I think we all know that we are living through unprecedented times. And it's the first time really in world history that humanity has faced a common challenge. I think in the past, all pandemics, wars, or natural disasters have only impacted some of us. But today, I think one of the things that's really connected us together as a global humanity is COVID-19. But one of the things that I've been reflecting on a lot over the last couple of months is that although we all face the same challenge, COVID-19, the same virus, it actually is going to play out very differently for all of us, depending on where we live. And I think in Australia, we have been so fortunate. You know, we've got the best healthcare system. We have the safety net of social welfare, and some of us are actually dependent on that at the moment. I think it has been tough for each and every one of us in our community. But the safety nets that we have here, we don't have in our program countries. And I think everyone on this call knows this more than anything, because all of you know so much about the communities where we work. For those that are new to us as well, we will talk about those challenges, but I think it's pretty clear to all of us that the challenges we face will be different in the program countries, and the impact will be far more severe if organisations like the Hunger Project don't act. So today, I think we've gathered everyone here today to really give you some insights and understanding of what life is like for our communities in the villages at the grassroots, and to hear how our model of community-led development has really come into its own. I mean, I think all of you know the true power of unleashing the natural leadership in people, and you all know the reach of the Hunger Project to 16 million people globally. But when COVID started to impact everyone and we knew we needed to act, I think it really showed the full power of our model, having 500,000 leaders trained in our communities, all ready to take action, who in turn were in a space and a place to reach out to 16 million people. I think one of our main intentions was to make sure we reached every last person. And the communities themselves have been innovative and have really been so incredible and powerful in mobilising themselves. Our second pillar is to mobilise our community, and they have been doing that to keep themselves, their community safe, and to really halt the transmission of COVID-19. But that's really for Diane and Rowlands to go into a lot more detail about that, but we're really fortunate to have both Diane and Rowlands on this call. Rowlands, I think many of you have met, those of you who've travelled to Malawi, and I think some of you may have even met Rowlands when you were in Australia a number of years ago. But Rowlands, actually, some of you may already know this, but has been promoted to Global Vice President globally, and he's now Director of the whole of the Southern Africa region. A well-deserved promotion, and he's really at the cutting edge and leading our response on COVID-19. So Rowlands, thank you for being with us today. It's incredible. And also we have Dane Grady, who is the chair in Australia. I think many of you know is an incredible leader in our community. She is the non-executive director for the last 24 years across so many both public, private and not-for-profit organisations. And really, you know, I think our response in Australia in the Hunger Project has really been guided by Diane's experience. So thank you, both of you, for being here today. So I'm going to hand over to both of you in a moment, but there's a couple of housekeeping things I just want to do. As I said before, we can't see you, you can see us. And we also can't hear you. But if you look down the bottom, there's a Q&A function on the right-hand side on each of your screens. And we really welcome you to type out any questions that you have. And Tara, who is, I think many of you know, our head of communications, is going to collate those questions, and we're going to have some time at the end to be able to have that Q&A session. So for now, I might hand over to Diane and to Rowlands. We'll both disappear off the screen and we'll leave you in their incredible hands. Okay, thank you, Diane. I'll leave it to you.
Okay, thank you, Melanie. Thank you, Tara. And welcome, everyone. It's terrific to have you on our podcast. And we feel so fortunate that Rowlands has been able to join us and really give us a picture of what's happening on the ground in Africa in particular, but also in India and Bangladesh, where we work. Just as a little bit of context, probably as contrast to what we'll hear from Rowlands. In Australia, we have been dramatically affected by COVID-19, like the rest of the world. But overall, I'd say the government and the community have done a pretty good job of what they call flattening the curve. And we've had under 100 deaths so far, and the medical resources seem able to cope with anything that's likely to come. That said, the impact on the community has been huge. Many businesses are going under. Many people have lost their jobs. It's very likely that those jobs and those businesses will not come back. We've seen some behavior in the community that we're not proud of. People fighting Rowlands over toilet paper in the supermarkets, literally fighting over toilet paper. A real scarcity mindset. But overall, I'd say the community has been really, really good in responding to the need to do the self-isolation that the government has said we need to do in order to control this virus. What will be more difficult will be getting our economy back running. We've been fortunate that our government has had the resources to supplement people's income who no longer have work or significantly reduced hours, but the debt that they have gone into will take a long time to return. So even though the medical situation seems more under control, the economic situation is just beginning to unfold. That said, relatively speaking, Australia is in an incredibly fortunate position compared to many countries in the world. So, Rowlands, I think it's a good place to stop and ask you what it's been like for you personally and for your family, and what life is like in Malawi, where you live.
Thank you very much, Diane. And thank you everybody for joining us on this webinar today. It's really pleasing that we can manage to connect. So I'll give you a picture of how life is with me as a family and with my family, and also the picture in the country. As a family, we are home with children. We've got 2 children, and they came back from school. School had to close about a week or 2 before the normal closing time. And right now it's 3 weeks after opening of the new school term. But students have not been allowed to go back to school. So schools remain still closed. And I remember my boy telling me, oh, Dad, I thought this was going to be, 1 week or 2 weeks, but it's now turning out to be months. How long are we going to stay home? And so we are able to do our shopping from the shops as of now, because of some of the developments that I will explain later on, a few of some restrictions. At home, for me and at my house, we listen to the radio, we can watch TV. It's a very complete different picture with the rural community that I will explain later on. Of course, there are no international travels as of now. And my last international travel I did was in January, and we haven't traveled. And so we also cannot receive investor trips in any one of our program countries. That's about me as a person. We're managing it. We are always at home. For us, it's really restrictive. We know we have a personal responsibility and leadership as a family. As a country, it's a different case. And if you ask me as a person now, one side I feel nervous, the other side I feel the leadership, and then the name I have on my mind always is adapting to the new reality in which we find ourselves. Malawi as a country has registered 39 cases. And out of those 39 cases, 3 of them did not survive. And as of now, the cases have spread across the country. So right from the northern region, central region, southern region, and we have also seen 3 cases in the districts. So the other 36 are in the main cities. But now we've seen 3 cases in the districts of the country. And out of those 39, what is really worrying as of now is that Malawi has started registering now local transmission, which is not the imported transmission, but transmission from person to person within the country. That is a worrisome development as we talk right now. Now, on 18th of April, the government declared a 21-day lockdown, but they had given 3 days for people to prepare. That means besides the normal social distancing, besides the closing of schools, besides restrictions on transport, because public transport is still operating, but they have reduced the numbers. Because of that, the cost of travel has gone so high, it has even doubled. Now, in spite, on top of those restrictions, the 21-day lockdown meant that you can't get out of your home. You have to be within your area. Only essential workers were allowed to work. No movement, you have to be restricted. People had to seek permission to leave their area in their homes. And that created panic. And so a group of NGOs, which is called the Human Rights Defenders Coalition, went to court to seek an injunction so that they wanted people to be protected. And that injunction was given, and it has also been extended. And that, again, we don't know where it is going. So it's like a country in suspense. There was a time also the nurses and midwives went into a stay away, because they said they didn't have a lot of personal protective equipment. And so they stayed away from work, which means that even with malaria, coughing, you couldn't be treated. And that also created a lot of problems in the country. So that's the situation in which we are as of now in our nation, in Malawi.
Thank you, Rowlands, for just giving us a little snapshot of what life is like. Can you just expand that to some of the challenges that are facing the communities where the Hunger Project works in other countries in Africa, as well as in India and Bangladesh, just in general, some of the particular challenges that the COVID-19 has brought?
So thank you. I think one of the main issues is the issue of communication challenges. In Africa here, I know that in Australia you can hear, I'm able now to do webinar with you, but people to communicate is difficult. Literacy levels issues are also having a bearing. I know, in Ethiopia, a journalist was interviewing a woman about COVID. And what happened was the woman was answering questions as if she's answering questions about HIV when she had virus. So there is a problem of access to information. And when they get the information, some of the people are getting information which is misinformation. And so to debunk that, it's one of the biggest challenges that we have. when we talk of access to washing hands, services to washing hands, water, soap, most of the communities, as you know, in Africa, especially in sub-Saharan Africa, the numbers vary between 15 to 29%. That's the only population that has got access to hand washing facilities with soap, with water and soap, which means that you are talking of a number of about 79% not having access to hand washing facilities. The density population in Africa here, in one house, you can have a house of 2 rooms or 3 rooms. So one room is taken by the father and the mother. The other room is taken by children who are males, who are boys. The other one is taken by children who are girls. So if you have 8 children, it means the other room has got 4, the other one 4, and then the father and mother takes. So the social distancing within the house is also a problem, not only outside the house, but also within the house. People living on daily wage, you know, majority of the people are not living on types of jobs that we have in Western countries. So it means they have to make money every day so that they can eat and bring food on their table. And that when you have a lockdown, it means that they can't trade. For example, right now, it's harvest time in sub-Saharan Africa. That's the time women and men will go out to sell produce. When you have a lockdown, it means that the market access is restricted. Your demand goes down. It means you cannot be able to make the same amount of money you would make earlier on. Further to that, it's our own already struggling health system. As I gave you an example of Malawi, you know, where the health system, the workers, the frontline workers are not well protected. So this is already a struggling health system, and then COVID brings in another layer of burden on that. And that is causing a problem on our health system, giving it pressure to respond to the virus, to the response system against COVID. Thank you.
Thank you, Rowlands. That has really painted, I think, a good picture of the challenges and really put what we are going through in Australia into perspective. You've been a leader in the Hunger Project for over 17 years, and you know better than almost anyone about how our community-led development approach and our unique vision, commitment, and action methodology work. So can you just help explain how the way the Hunger Project does things is helping us to help our communities cope with the COVID-19 situation?
Thank you very much, Diane. I hope I'll have enough time later on as we go to give specific examples, but let me take this question at a slightly higher level at this stage. I must say I'm really proud to be part of the Hunger Project, because in the work that we do with the Hunger Project, we believe in the leadership of the local community. The people themselves are the change agents. They are to own and drive the change process. And one of the unique things we have been driving is the mindset change, right? To believe that we can, to shift from we can't to we can. We start with I can't to I can, and then we can't to we can. That is a very important mindset, because right now we just realized that in the COVID response, people have 2 types of mindset. It is either you have a mindset of a victim or you have a mindset of a leader. And we have seen those 2 differences in the mindset of the communities we work in and the communities we are not working in there. So the vision, commitment, and action mindset change has actually shown us, it's like a test to us to see how strong that mindset change program has been on the ground. So we have seen the leadership rapidly rising up in our communities that we work in. On the other side, also, we have seen on the speed at which these communities have responded to the COVID response initiatives by their own governments, as well as by their own community areas and the leadership steps they have taken. The animators, or we call them community leaders, have expertise to mobilize and influence mindset change. Now, mobilization is very important when we talk about COVID response. Not only mobilization, but a speedy mobilization. We have a community asset on the ground of about 500,000. This is about 500,000 of community leadership, of community leaders, which we call animators, who are highly trained, and they have been mobilizing their communities to disseminate information. Remember, I spoke about access of information and access to the right information, as well as debunking the wrong information that is there. So the Hunger Project, we see community members, leaders, as leaders to drive their own change process. We also consider the local context. So people are ready and willing to look for local solutions. I'll give you examples later on about what has happened, for example, in Benin, in Malawi, and other places, the local solutions that have actually emerged. We also respect human dignity in the work that we do, because we believe that people with the training and the resources should be allowed to unleash the potential of their leadership within their own communities. So at a high level, that's how I have seen the leadership of the communities we work in show up. And this is pleasing to me because it is actually validating the principle that we believe in about mindset change. So it was, these communities were established for purposes of long-term strategic action. But what have we seen with this COVID? We have actually noticed that they were not only ready for long-term strategic action of ending hunger and poverty, they were actually rightly positioned to quickly respond with a correct mindset and take leadership to mobilize their communities. It's different from go as an NGO going into an area to start mobilizing a new community. Thank you. I can talk over and over again.
No, that is
really, I am really impressed and fascinated with the way the community leadership has showed up.
I think that is just so exciting to know that our work can pivot to respond to this challenge so quickly. One thing that I'm curious about, Rowlands, is that you are isolated at home like we are. How is the Hunger Project able to actually deliver our work when you aren't able to move? How does this actually happen?
Exactly. Thank you very much. That is very correct. As you know, it's not only me, but the whole team of our head office staff is now working from home. As an organization, we operated at 3 levels. Number one, we looked at reprogramming our programs on the ground to make sure and see how they continue, even though we as head office staff have retreated. We also looked at ensuring safety and peace for our staff. And we looked at the COVID specific response. Now, how are we able to continue working, or how is the work still going on? At 2 levels. As you know, the Hunger Project believes in local capacity, not only for the community members, but even for the people that we hire. And so most of our epicenter project officers, they are actually based already right in the communities where we are. So right now, they are in there, which means that they can be able to meet in following government restrictions. As you know, some governments have said 5 people only, others have said a maximum of 10 people. So this lockdown is shaping differently in different countries in Africa. So they are able to do that while observing those restrictions. Further to that, the animators that I spoke about, the 500,000 community leaders, those are the people that are existing in the community areas. We have been so amazed to see that some of them have even been able to send access to WhatsApp information, phones and all that. It's not as many people, but the few of the animators that have access to phones in our community areas, in the epicenters, we have seen them actually take over. It's like taking over the role that we do. And we are saying, this is how it has to be. Sending pictures of what they are doing, how they are modifying the program. And I'll be happy to speak about those modifications on the program. So we have been fortunate to have those type of leadership on the ground, that they are able to disseminate the message with the communities. They take pictures and send them. Others can even send an audio clip and say, this is what we are doing, and they even ask a question. And then we also transmit that question, the answer back to them and say, this is how you have to do it. Further to that, as you know, we also have, we have seen these animators join different government initiatives. They have joined civil service committees, civil protection committees. In Uganda, we have seen them join the teams that are identifying people that need special response from the government. In Burkina Faso, actually one of the epicenters, the local government declared it as the first response, the fastest and the first. It was an epicenter of the hunger project in Burkina Faso. Based on that, the municipality took a decision to make sure, that all the members of the epicenter committees should be adopted members on the established government local structures in the areas that they operate in. So that's how fortunate we have been with the way we work, even before the COVID, and then it has just activated itself to the way it is now. Thank you, Diane.
Rowlands, I think what you've described is such a wonderful example of the leader mindset that you described earlier, where people are taking the initiative themselves and not waiting to be told what to do. And I guess, again, that's such a testimony to how the way the Hunger Project works in changing mindsets to making people believe that they can do it, is really able to respond in this situation. You've mentioned the difference between different countries and the need to respond locally and recognize that what's required may not be the same. Can you give us a little bit more flavor about the unique challenges in Africa, and then we'll talk about a couple of the other countries if we have a chance, but start with giving us more specifics about how the Hunger Project has really worked.
Thank you very much, Diane. So as you know, right now we are working in 9 countries in Africa. In those 9 countries in Africa, as we speak right now, at least as of yesterday, according to World Health Organization, we have a total of about well above 29,000 cases, right, that have been confirmed, and about 1,064 deaths in these, which are COVID-related deaths. Now, we have to treat these numbers carefully, because you know the other challenge Africa faces. It's a unique place. And one of the challenges it faces is access to testing. Yeah. When the first case was detected in February in Africa, only 2 countries in Africa were able to run their own tests. Great, exciting, thank God. Now the number has improved. At least we have 44 countries. But those 44 countries, the situation is, it's not everyone who wants to be tested that can be tested. So the testing, even though the number has risen to 44 countries in Africa at least, and that's a great job from 2, but the problem is access to testing is a big, big situation. And it's not only in Africa, but also in Bangladesh and India, as I will explain later on. So we should keep that in mind, that is likely, you know, it's a tip of the iceberg due to the testing limitation that I have mentioned. Now, broadly speaking, the challenges of Africa are many. But the main one is the government, unilateral government lockdown decisions, where the government does not consult all the stakeholders they have. At the same time, you know, I'm also quick to understand on the other side. So to what extent can most of the African governments be able to cushion, you know, the socio-economic impact of COVID on their communities? That's the dilemma. So on one side, the government instituted, when those ones are just put in, you know, it creates a lot of problems. For example, in Uganda, the government totally banned public transport. People had to walk on foot. Now, what does that mean? The supply chain is broken.
Yeah.
Prices in the cities went up. Theft went up. Hooliganism went up. In the villages, demand went down. Perishable crops were crushed. Incomes were lowered. And so you hear people of mobbing one small car which was carrying food. They mobbed it because that was the only source of food that they could get. So in countries like Malawi, where you have limited transportation to few people, even though the price of fuel has gone down, but the price of travel has gone up. So there are those challenges that are there. Shops are closed when the government has passed those lockdowns. That's the biggest challenge that is there. A few countries have taken up steps, like in Uganda, they came in with food rations, and in Ghana also food rations and lowering of water. In countries like Malawi, until now it has not been implemented. Of course, recently, last week, the government has come up with new response, like a way of cushioning some of the people, but not everybody. So that's where the biggest challenge is. Now, from the response side, as Africa, broadly, let me speak first of all as Malawi. You know, as Malawi, when we talk of a lockdown at community level, it means that there will be a problem of issues of food security, there will be a problem of collection of farm inputs and all that, but we have seen the leadership that I spoke about in the epicenters. Using social distancing restrictions, they have continued to mobilize their farm inputs, like collecting maize back into their community food bank because it's a harvest time. We have seen that happening because they know that there is life beyond COVID. So how are we going to survive after this? You know, it's not only a health issue, it's a food security, financial issue. We have also seen, as you know, Hunger Project establishes rural banks in the communities. We have seen women being able to go to these rural banks. They say one person only in the bank at the time. So they walk in there in Malawi, in Mozambique, in Benin. Those rural banks have remained open, and people are able to get money from there and support their livelihoods. We have also seen decisions being taken at community level. You know the health centers that we established, epicenter health centers. All of them have remained open, and they provide health information to the communities in the areas that we're working in. Most of the animators, as I mentioned earlier on, they are participating on the government-instituted structures to support them to be able to respond to the virus. So to be honest with you, there is a response system that is coming out in the communities that we are working in, but Africa is unique. And we have to make sure that we avoid the cut and paste approach because it's different from Europe. It's different from Australia. When you just lock people up, you say, don't get out of your house. Remember, most of the communities, they have one public borehole, which means that people have to walk to fetch water there. The water system is not in the house. It is at a public place. So how do you lock them out in a house? So we need to be able to come up with those location-specific response systems. What does that mean? It means we need to have a participation of everyone, more especially the local community people themselves in the design of our response and avoid the top-down thing. I know our concern is speed, but we can do that. Even with speed, we can be able to hear the voices of the people that matter. Thank you.
Thank you, Rowlands. That gives us a flavor of just how difficult some things that seem to us difficult, like lockdown, everybody gets bored and wondering what to do. It's just so much more fundamentally difficult in Africa, and there's so much less resources to go into helping people cope with the loss of jobs and loss of food security and all of that.
Exactly. Exactly. I can give you an example, Diane, in Benin, actually, the animators there, they mobilize when they heard about hand washing and all that. They mobilize a campaign to say we want everyone in these few villages to have access to hand washing. With the little they have, they mobilized and they promoted hand washing. About 2,200 hand washing tippy taps were installed. Now, we as Hunger Project, we are saying, oh my God, that's the vision of a community in one area. How about having that vision as Africa, so that we have everyone of the communities we work in have access to hand washing facility? You know, that is a huge, because the community has just shown us that it can be done. And they have done it in a few of the villages. They are actually speaking to us as leaders to say, hey, you know what? This should be a campaign for Africa to make sure that everyone has access to hand washing facility with soap and water within their reach.
That's a really good point,
I'm sorry
Rowlands.
to interrupt.
No, it's a really good point. And I think here we are also talking about what are the good lessons we can take out of this in terms of transforming our communities and believing in what's possible. And it's just a great example of how these barriers that we sometimes feel are impenetrable can be broken down so quickly with the will of the people. Can you just give us a little bit of flavor for what might be going on in India and Bangladesh and any differences there?
Yes, as you know, India is another special case.
Yeah, definitely.
I think this also just amplifies the issue of being location specific in our response. So both India and Bangladesh, in India now about 39,000 confirmed cases, close to 40, I should say, and 1,300 deaths already confirmed. In Bangladesh, 8,000, around 8.7 thousand confirmed cases, and about 172. And both these regions have also local transmission, which are moving fast. Now, when we talk of India, you are talking of the biggest lockdown in the world. This is 1.3 billion people that had to be locked down.
Yeah.
And you know what that meant? When we think of lockdown in India, we should think of the tens of thousands of migrants within India, migrant workers, who come to the urban areas to work. They are a source of labor. Now, when you declare that, they can't survive. So they have to go back to their home villages. And what did that mean? It meant that as they went back, they also spread the virus from the urban to the rural areas. And I don't know whether that was thought very well, but that was the impact of that migration impact. They didn't choose to migrate. It's a lockdown that made them to migrate because they needed to find food and water, and they moved back to their communities. But then it also created pressure on the available food in the rural areas where they migrated to. And that created a huge problem of issues of deaths out of hunger. And we are feeling now in India a huge starvation, which will cause deaths in that country. Same with Bangladesh. You know, again, there is a lockdown in Bangladesh. It hasn't been spared. But we have also seen there in Bangladesh a team of our animators and the people that we work with conducting different activities to reach the people. But maybe let me talk about India. Our team in India works with elected women representatives. And within a period of 10 days, they actually reached out to 8,000 women with information through phones. And those women reached out to their community workers, to their community members. And within a short period of time, we actually reached a lot of people within India. Same with Bangladesh. We have volunteers on the ground in Bangladesh. And most of those volunteers, they were also reactivated, and the community response was enormous. And they reached out to the community members that we are working with in Bangladesh. They use the three-pronged approach in Bangladesh because of the absence of vaccine, as we all know. They promote awareness. They also supported our animators in Bangladesh, supported identification and isolation, And then they are also forced, to go into the area of identifying households and connect them to the government response system that was providing food subsidy program to their community members within their country. So that's how leadership also has been showing up in both in Bangladesh and India. Thank you, Diane.
Thank you, Rowlands. And we'll soon turn to questions from all of you. But in listening to you, Rowlands, I think what's really come through very clearly is not only the challenges of just dealing with the disease itself, but the challenges of dealing with the response to the disease, the challenges of dealing with lockdown and the flow-on effects from that, and the incredibly important necessity to have a local response, not a generic one solution fits all. I guess the other thing that comes through from what you've been saying is just the opportunity to have our communities really show what's possible in all sorts of new ways, and the way that they have used the Hunger Project methodology and the way the Hunger Project works to absolutely take responsibility for dealing with this situation. And when I step back and I look and I think about the 500,000 local leaders on the ground who know what their communities need, who know how to communicate and educate, and who importantly are trusted. That's really fundamental, and that's the Hunger Project way. The second thing that comes to mind is that you mentioned really clearly is this leader mindset rather than victim mindset, and that people feel empowered to take action, not to sit around and wait for somebody to tell them what to do. And I think that's just so exciting the way you laid that out. And also you mentioned the briefly the partnership. I mean, the Hunger Project doesn't feel we have to do everything ourselves, so recognizing we need to link in with the government and link in with other NGOs to help deal with the situation. All three of those are really important elements of the way the Hunger Project works. In summary, I guess I'd say this pandemic has reminded all of us that the world is truly interconnected. We have to work together to stay safe, to end hunger, to end this terrible disease. In Australia, sometimes people talk about putting up walls. That's not possible. Walls will never work. So, while for a few weeks here, as I mentioned at the beginning, we had a scarcity mindset, I really hope that now all of us can look to the future and find ways to continue supporting the work the Hunger Project does, because it's so important and it actually delivers, and it's very exciting. So with that, Rowlands, let me thank you. I know we'd love to hear from you for a long time, but we're going to ask our audience now through Tara to, if they have questions they want you particularly to answer.
Thank you. My pleasure. Thank you.
Hello, we're back. And I've got Melanie with me. You're on mute, Melanie, just so you know, in case you want to join in. But lots of questions flowing in, Rowlands and Diane, as you were chatting. And we aren't going to get to them all, but I'll ask you a couple and we'll see how many we can get through. I'll start with a question from Colin Tate. This one's for you, Rowlands. The question is, with cities like New York and London struggling to manage the crisis with their abundant resources, how do you feel? Are you worried about Africa and other developing areas given the lack of government and health system capacity?
Thank you. Yes, as I said, that's one of my biggest worries.
Yeah.
Okay, and what I am hoping for is that what the community initiatives taking place now will continue and even be increased, because at least Africa is having an advantage that it was not the first one to be hit. And so the issue is, what are we learning from those places where it was the first to be hit? Now, if the countries which have a lot of resources, they have a wonderful health system, have been overwhelmed, what picture of Africa would we see if that type of heat is allowed to move within Africa? If that type of wind is allowed to blow on Africa, which is already struggling to handle malaria, to handle influenza, to handle a broken leg, to handle a chest pain, to handle headache. Now, the lesson we're learning now is that we can use hygiene, we can use social distancing, we can use all these to manage the spread and mitigate it. Can Africa move fast and take advantage of the fact that it was not the first one to be hit and it learned from other countries? Africa should not be cheated by the thinking that, you know what, we are immune. You know what, we are what? Africa should not be cheated by that. Africa should take advantage of this and learn fast. So yes, I am really worried. At the same time, I am hopeful, because Africa has shown us that Africa can do it. I've given you examples of people moving in with tippet-ups. I've given you examples of communities setting up. In Senegal, they have megaphones, which they are using. Animators are using megaphones. Others have went on the community radio. In Zambia, a consortium of community-led development institutions has come together and come up with a community-led development response, even a voice to their own government. We see those happening in all the areas we're working in. It's an example that Africa can do it, and it's showing leadership. And that's the path Africa should maintain. So yes, anxiety one side, hopeful, and feeling of leadership on the other side, because it shows it can be done. If Africa does not do it, it's because we choose not to do it. If the world does not stand with Africa to do it, it's because we choose that we don't want to do it, not because it cannot be done. Thank you.
Beautiful. Thank you, Rowlands. Another question, and maybe sort of leading on from that, from Alexandra, around whether you had noticed anything different or unique about the communities in which THP works and their resilience towards this situation as compared to other communities, or perhaps even within the communities that we work, a phase 1 epicenter, for example, versus a self-reliant community. Have you noticed any differences, and can you comment on that?
Yes, we have noticed differences. Let me start with communities where we work and communities where we don't work. Okay, the feeling, the mindset of victim and leadership has been very clear. I gave you an example of what happened in Burkina Faso. The area that responded the fastest and reached out the widest was actually an epicenter area of the hunger project. That's why the government recognized that and said, there's something different about this area.
So good.
And the leadership of the community to say, okay, you know what, let's not close rural banks, let's not stop collection of maize, let's not stop this. In Mexico, we have also seen that, where the cooperative knew that they were going to be closed, they even went and bought supplies and used those supplies to distribute to their community members to make sure that they are well supported. So that has been clearly seen. Information spread in the areas we are working in and the areas we are not working in. You can see those differences. Now, let's come to communities where we have just started and communities where we have not, we are in phase 3 or phase 4. There is also a difference. In the areas where we've just started, you can see even communities struggling. One, we don't have as many animators that we have trained in those places. Okay, so the reach and the depth, the speed at which they are, the depth of the reach, the width and the speed is different from the areas where we are already working. Issues of microfinance, like livelihoods, systems to support livelihoods. Okay, it's different from the areas we are working in phase 3, phase 4, because in those areas, those systems are already established than the areas where we are not yet in phase 2 and in phase 3. For example, a phase 1 epicenter doesn't have a health facility. A phase 1 epicenter doesn't have a rural bank. A phase 1 epicenter has not started my food security program and microfinance village savings. So we have seen those differences between areas we work in and areas we don't work in, as well as in areas we work in, but at different stages. Thank you.
Thanks, Rowlands. There's lots more questions coming in, as even you're just talking now.
Okay.
Thank you for that. Another question, maybe around, I think you might have spoken about it briefly, but to your point about myths and education, we've certainly heard some stories here around myths that have been sort of being shared and spread rapidly. I mean, that same happens here as well. What has been your experience around that, and how has the Hunger Project helped to respond to that?
Thank you very much. Maybe one of the issues I do not have enough time to speak about in my answer to questions of Diane is the issue of what other factors are also affecting this. You know, in Africa here, you cannot divorce. I've heard it also in other countries, but there is an impact, an influence also of politics in the whole COVID thing. You're right. Malawi is supposed to have elections in July. Ghana is supposed to have elections in December. Another country as well. Now, most of these are already in the election mode. Now, when this comes in, you have political parties taking different stands for whatever reasons. Okay, for example, it's not unusual. It has not been unusual to hear and see here in Malawi. There have been newspaper stories of a political member, a member of parliament saying there is no COVID. It's not true. And that's an influential person speaking there. That has an influence. Okay, so it's not only social media, it's not only what, but there are also these other factors. But great, thank God, right now, we also have different political party leaders coming up and saying, no, COVID is real. So that's what is happening. So there could be an inside of politics, but in the community areas where we are working in, we have been working with animators, sending information. Remember, I've mentioned that our epicenter project officers are already within the community. So they are able to reach 1 or 2 or 3 people, key animators, and provide them this information. Posters, distribution of posters, messages on the radio, messages on megaphones, as well as us from staff sending that information to the few animators that have got cell phones. So that is what has been the role of the Hunger Project. And where do we get that information? Because credibility of the source of information is key when we talk of debunking myths and rumors. We have 2 main sources: World Health Organization source and our credible source from our own Ministry of Health within our own local governments. So we have even designed posters, messages on the radio, information to the animators, and even taking public address systems, a vehicle moving, disseminating that information in the community area. That's what has been happening. Thank you.
Thanks, Rowlands. The next question, I think this is probably the last one that we'll get to, just because we're short on time. We could ask you many, many more questions, Rowlands, obviously. But also, while we have Melanie and Diane here, one of the questions is, could you comment on or tell us a little bit more about what the impact of COVID-19 has been on fundraising?
Mm-hmm, yeah. Do you want me to take that, Diane?
Yes, please.
Yeah, sure. Look, I think, you know, the reality is it will impact fundraising for all not-for-profits. I think the FIA, the body in Australia, has predicted about a 20% drop. But having said that, I think the wonderful thing about and the strengths of the Hunger Project, I think probably lay in a couple of different areas. I think the first is literally our community, the long-term committed investors who walk with us on this journey and know that it is a long journey, but at the end of it will be the end of hunger. So I think the long-term committed investors, you know, in our community will keep us strong. I think the other part of it also is that we do have good financial governance. In Australia, I know we do keep a reserve and make sure that, I think, Diane, the number of times we've spoken in board meetings about having a calculation that says if no more money comes in today, how long, you know, how long can we keep working? And I think making sure that we apply the sorts of tests like that to make sure that we are strong into the medium term is important. And I think probably the other part that makes us really strong is the incredible leverage. Every dollar invested goes such a long, long way. And I think that makes a huge difference. But also at the moment, we're actually running a global campaign, and it's going to go literally, hopefully, viral around the world. I think hopefully some of you have already seen it late last week, the Stay In, Reach Out campaign, where we're inviting people to stay in and protect their families, but also reach out to the 16.5 million people who we work with. And we're inviting people to invest what they can to enable other people to continue the work, to enable the $500,000 volunteers to keep doing what they're doing. And we're talking a little bit about, you know, the idea of giving up a coffee or a beer or dinner, things that we can't do now. And in our methodology, we all talk a lot about what, you know, I can't do, I can. One of the things that we can do as a community is reach out and do those things, invest the same amount in that potential. So we're trying to do things a little bit differently, and we're trying to make sure that we continue and enable people like Rowlands and our leaders to keep doing what they're doing around the globe. You know, it may mean in the near future we won't start working in new communities. We've actually gone into, I think it's 700 new communities globally in 2019, which is amazing. But I think in the immediate time, we won't be going into new communities, but we'll make sure that we keep walking the path with our existing communities and doing everything that we can to continue our work. Yeah.
Beautiful. Thanks, Melanie. We didn't quite get through all the questions, but we are right on 6. So I might, yes, I know that flew by, but I might, Melanie, just hand it back to you, actually, just to close the call.
Yeah. And look, you know, we love hearing from our community. Anyone who knows me well knows I'm an extrovert, so please reach out to me because I love to hear from you at the moment and connect. So if you have any questions, reach out. But look, Diane and Rowlands, that was just incredible. You know, I think I have been immersed in this work for the last many months, but actually I've learned new things today. And I think the main thing that I learned about the Hunger Project, and I think, Dane, you've already summed it all up, but I think it's just resilience is the word I want to leave people with. The true resilience of our communities, and that includes all of you on this call today. It will take resilience, and it will take all of us. So thank you for joining us. Thank you for being part of our community. Yeah, and it's just been lovely to be on this call with all of you. Thank you, Rowlands and Diane. Thank you, Tara.
Thank you. My pleasure.
Thank you for organizing. Thanks,
Thank
Rowlands.
you all.
Yeah.
Thank you
Thanks
all
to you
for
all.
joining us.
Love to you all.
Bye-bye.
Bye-bye. Thank you.
And people are sending in lots of love by the messaging right now to you all. So thank you.
Oh,
Lots of thank yous
Thank
and
you.
lots
That's
of
so
sending you
lovely.
love all the way to Malawi, Rowlands.
Thank you very much.
All right. Thanks, everyone. Have a good night.
Thank you.
Bye.
Bye.